Good evening, everyone. My name is Dr. Firoza Godrej, and I am a board member of the Asia Society India Center. I'm delighted to see members, patrons, friends from across the world joining us this evening. For those of you who are joining us for the first time, the Asia Society is a leading educational organization dedicated to building awareness about policy, business, education, and the arts from across Asia for a global stage. Through our 13 global centers across Asia, Europe, and the US, we stay committed to sharing contemporary studies, highlighting emerging trends, and spotlighting innovative solutions with a view to deepen understanding and engagement between Asia and the rest of the world. The COVID-19 pandemic has significantly altered our day-to-day functioning. The stretched national and local lockdowns, closure of educational institutions, and working from home has become the new normal. Unfortunately, this indoor confinement has resulted in the emergence of what I call a shadow pandemic. Through a three-part series, we hope to understand the impact of COVID-19 on the mental well-being of three specific, very vulnerable groups: our children, the women in our community, and our elders. For more than a year now, schools and higher education institutions have remained shut across the country. While online learning has certainly benefited a large group of students, it has also led to a significant increase in exposure to digital gadgets and, of course, the web. The absence of in-person learning and informal peer interactions has brought to the fore a multitude of emotional and mental challenges amongst children, ranging from eating disorders, depression, social awkwardness, and in some cases, serious issues, including drug abuse and the most tragic, suicide. How should these early signs of distress be identified, and with what support frameworks needed to be developed to address these psychosocial risks among this vulnerable group? Our program this evening will delve into all these aspects in detail. And I have the honor of hosting a distinguished panel to discuss today's subject. Please allow me to introduce our esteemed speakers on behalf of Asia Society India Center and extend a very warm welcome to all of you on behalf of Asia Society and all those who are listening to us this evening. Dr. Vikram Patel is the Pershing Square Professor of Global Health and at the Blavatnik Institute's Department of Global Health and Social Medicine at the Harvard Medical School. Dr. Kavita Arora is co-founder of Children First and loves to connect with children and young people. Dr. Anjali Chhabria is a leading psychiatrist and psychotherapist based in India. Amrita Tripathi is a freelance journalist, a novelist, and a passionate activist in the space of mental health awareness. Thank you, everyone, for being with us this evening. A bit of housekeeping before we proceed. All those who are joining us on Zoom, please leave your questions in the Q&A box and not the chat box. For our audience on Facebook, please drop them in the comments section. I would now like to invite Amrita to commence the discussion with just one more housekeeping point. Dr. Vikram Patel is in a different time zone and he is requested to be relieved at 7:30 p.m. IST. So if there are some urgent questions, members of the audience, please post them to him and Amrita will address them before he leaves. He has also agreed to answer the questions on email later, as indeed all the speakers have very, very generously decided to share their emails and their contacts in case members of the audience have some questions later on. So thank you so much, everyone, for joining. And on behalf of the Asia Society India Center family, I welcome you once again, and I welcome our speakers, and now hand you over into the able hands of Amrita. Thank you so much.
Thanks so much, Dr. Firoza Godrej, for that. And all of you who are joining in, do feel free, as you heard, to pop in your questions and your comments, whether it's through the comment section or the Q&A section. I think we got a really great amount of contextualization. So I'm just going to start with just very briefly saying, depending on what reports you've been reading, depending on the lives you're living, many of you have lived experience of what we're going to talk about, firsthand experience, experience within your own families and friend circles. We have been hearing about how COVID-19 is negatively affecting the mental health of millions of children. Today, we want to talk essentially about who's at risk of psychological distress. We want to lean on our incredible panelists to understand what we need to know moving forward. How can we all learn to provide psychological support if need be? And what are some great examples of what's already been done? So it's not going to be all gloom and doom, I can promise you, but I'm going to start by just asking upfront our panelists the question of the hour, really. What is the impact of this pandemic on young people's mental health? And I'll start with you, Dr. Patel. What is the evidence you've been seeing regarding the mental health of young people in this context?
Thank you, Amrita. First of all, also, I want to thank the Asia Society for championing this extremely important subject. This isn't the first time the Asia Society has done this, of course, and I think it is really important when organizations, institutions like the Asia Society, which really converse on a variety of issues that concern the people of India, when they take up a subject like mental health, which I believe for far too long has remained within the narrow confines of conversations in biomedicine and the related health disciplines. And, really, we need to take it well out of that, and particularly important in the case of young people's mental health. So I want to start by simply saying, first of all, that young people's mental health issues were a concern even before the pandemic. What the pandemic has done is simply allow us a moment to reflect on the impact of the pandemic itself on mental health, but it's also uncovered an issue that's been around for decades, a concern that has been largely neglected, actually, by policymakers and society more broadly for a variety of reasons. I'd like to say that we know, and we've known for a long time, that most mental health problems, in fact, begin in young people. It's estimated that roughly about 75% of all the mental health related sickness that we see in a population begins before the age of 24. And I want to stress this is before the pandemic even began. We've known in India that young people's mental health problems were a major cause of suffering, even before the pandemic, because we've known for the last 10 years that suicide is the #1 cause of death in young Indians. Just pause and reflect on that. More young Indians kill themselves than die of any other cause in the whole lexicon of medical problems before the pandemic. So what the pandemic has done is it's just, I think, emphasize and increase the kinds of stressors that already existed, and I'm sure we'll talk about what those are in a moment, and therefore increase the level of distress that young people are facing. Data on the pandemic related mental health problems is not readily available for most countries, and India is one example. And where the data does come, it's highly selective data. It's usually collected online, and as we know in our country, only a minority of young people, and this is also disproportionate in terms of the social classes, actually use online media as much as we'd like to see happen. But in countries where we have more representative samples, for example, in the US, data from the CDC suggest that there has been a gradual uptick in self-reported distress over the last 18 months. In fact, in around January or February this year, the CDC, this is the Center for Disease Control of the US, which is a federal agency, reported that nearly 60% of young Americans had reported significant levels of distress related to anxiety and depression. I want to emphasize, though, that we should not confound this with mental disorder. A lot of this distress is completely normative. By that, I mean, it is completely understandable reaction of the human mind to the extraordinary situation that young people are facing. Nevertheless, it is true that a subset of those individuals will have very severe mental health difficulties, and that these may in fact require an active clinical intervention. And finally, I just want to end with saying we should also be cognizant that these problems are not distributed evenly across the population. Certain groups of young people, and these are the same groups who were at risk before the pandemic, have also heightened risk during the pandemic. As a couple of examples, young people who come from low-income families have been particularly badly hit, and we'll, I'm sure, talk about the remote education, how that has widened disparities in most countries, including India. Young people who belong to minority groups, such as sexual minority groups, are another group. So, you know, it's important to remember that the burden of mental health difficulties are disproportionately distributed in the population. And finally, one more point. You know, if you remember when the pandemic began, and we hear a lot about social isolation and the impact that has on people's mental health, and this is correct. But remember, when it began, most people's concerns were for older adults. We were anxious about older adults' well-being, both because we felt that loneliness would have a very significant impact on their well-being, but also because this was the group that was most threatened by the infection itself. Ironically, we find it's exactly the opposite pattern. In every single country in which the burden of mental health difficulties has been examined across the life course, in every single country without exception, it is in fact the opposite. That is to say that it is the young demographic that has been much worse hit. Paradoxically, the older population actually has done pretty well. And we may ask some questions again, why is it that this has happened? But I'll pause now and look forward to hearing from the other panelists.
Thanks so much, Dr. Patel. There's a lot to unpack there, and we're going to hope to, explore some of those topics more closely with you and the other panelists as we go through this next hour. Dr. Arora, if I can come to you, when you're looking at talking about the impact of this pandemic on young people's mental health, what are you seeing when you and your teams are actually dealing with young people, children and adolescents, children first? I believe all the counseling has moved. It's virtual, it's online now. What is some of what you're seeing?
So I think carrying on from what Vikram is saying, I'd say that there are differences in what we are seeing with the youngest population, so to speak, 0 to 6 years. This is the silent part of the pandemic, because these children don't have a voice to say this is what we need. There is a slight difference in how they're presenting in the 6 to sort of 12 or 13 years of age, and then the 14 plus till the age of 20-25 are presenting differently. So I'm going to try and quickly talk a little bit about what the differences are between these three populations, starting with the youngest first. So I think if we keep ourselves in the shoes of a 2-year-old or a 4-year-old, right now, their developmental needs are very different. They're growing up, their brain is growing up in a very different environment than usual. So what's starting to look apparent to us is that the face of childhood is changing. The developmental milestones themselves are changing. Children who have never been exposed to the kind of movement, posture, sensory motor, multi-sensory environment that they would usually be. So a 12-month-old or a 2-year-old or a 3-year-old is developing very differently, and it's a very fast neuroplastic time for brain development and for development of children. So the question is not what they are not getting. The question is, what is it that their brain architecture is actually getting right now? And therefore, what is it going to look like? So this is not necessarily only mental health. At this point of time in life, it's also developmental needs. And these are getting impacted. And children are looking like movement itself or going out itself is a milestone, which was not the case earlier. Or people coming into the house to socialize now as things are opening up. The younger children are actually not used to it. And oftentimes what I hear is that there is a lot of stranger anxiety. That if the visitor is there and a child is not used to it for the last 2 years, 2.5 years, they have not really gone out at all. There is quite a lot of difference in how they're reacting to human connect or relationships. In the slightly older age group, where children would usually go into school or preschools at the age of between 3 to 4, many of these children have not seen offline school or school in the way that people knew. So those developmental needs that came from the social, emotional, peer interaction, those ones are getting affected a lot more. Yeah, most of their sort of exposure is online or at home. As you grow older, the 6 to 12-year-olds, this is the age when children start having a sense of self. So they are manifesting differently. This is the age group that's talking a lot about fears, about anxieties, about now if school is going to open, what's going to happen? Yeah, so this is where the fear and anxieties is a lot more. And 14 and plus, it's diverse. Children are sitting at home. These are the ones that often do have access to their friends or people that they know through technology, through social media. Here, the impact is very different. It is not just about what they are deprived of, but what they have more of right now in terms of what they're engaging in. Because again, the brain is growing. Brains need stimulation. So children are seeking, this is the age group that's seeking many different things. A lot of it is in the virtual world. So they are presenting with a lot more of body image issues that has exacerbated. It's not that these things were not there. I think that it is just like Dr. Patel said, there seems to be an increase, or maybe we are seeing it more. There is a lot more of languishing or a sense of listlessness, a sense of meaninglessness towards education. There is a lot more of the cancel culture, what's happening on social media, where if I do this, this will be canceled, or a lot more of seeking of intensity in social relationships in the online virtual world, possibly because of the absence in the offline world. And of course, a lot more of anxiety around their own future, what education really means, what relationships mean. So if we look at the developmental stages across the 0 to 25, we see that the appropriate developmental stage is the one that is most impacted right now. So I would say the depression anxiety spectrum is far more in the slightly older age group, and the sense of self and self-doubt, self-image, eating disorders, concerns about the body, concerns about peer relationships and in the interpersonal space are showing up a lot more. I also feel that a lot of children, the educational difficulties or the learning difficulties are popping up a lot more. The ability to engage with the online schooling system is really variable. And a lot of young people are struggling, and they present as we can't concentrate, we can't feel motivated to do the kind of education that we used to be able to do. And it looks more and more like attention deficit, but it may not be. So those are some of the sort of things that we are seeing as trends.
That's a lot. There's a lot in what you've just told us. And I'm going to come back to some of those because, some of you have started sending your questions in, for which we thank you. We'll be directing these to the panelists. As you know, we work in both your questions and the ones we've already sort of decided to discuss. Dr. Chhabria, let me ask you, when it comes to the impact of this pandemic on young Indians, what is it that you're seeing? What would you like to share?
So I think as Dr. Vikram and Dr. Kavita have already shared, now if we look at India, India is huge, so, and the differences are many. So if you're looking at a child in the slum who does not even have access to a device online, where there are 4 kids trying to share a phone to learn, in a house where there is a father who may be abusing alcohol, there is even lack of space. 2, you're looking at kids who are in, say, private schools, who are so bored of the gadgets. So we are looking at a lot of different spectrum across. So what we have definitely seen is that, yes, looking at the positive side, there are some who've enjoyed having their parents with them, spend so much time. And there are families who have actually become closer, and they've also, learned to adjust with each other. 2, we are looking at problems where people have either fallen sick, have lost, a parent, maybe 2 parents. 2, people who have not been allowed to get out of their house because of the COVID, and yes, there is the impact of social media, which is a huge topic by itself, because social media has unfortunately become the only way that people are interacting with the entire world. So right from parents struggling with, how much time do we allow them? How do we even access? How do we even know what's happening over there? How do we control strangers from coming into my child's world? To people being bullied on social media, so I think there are a lot of different issues, and that has impacted both the kids, the parents. I'm sure teachers were also impacted, because for teachers to suddenly start teaching and to even look at a classroom where most of the kids have switched off their cameras, and they have to even coax them to put the camera on. So to teaching these kids, I think it's been challenging. And yes, of course, the last 18 months have taught us a lot, So, but yes, I agree, mental health has never been as important as it is today. And I just hope our authorities, our governments would take this a little more seriously, and do what is required.
Yeah, I mean, at one level, as you all have been saying, we're talking about these issues. Now look at this forum we have. Thanks to all of you joining and those of you who are tuning in. We'll be coming to your questions as well. Dr. Arora, though, I do want to pick up on something that you alluded to. Dr. Patel was also talking about, which is that this is not a new phenomenon. Talking about young mental health and issues that come up, not conflating mental health with mental disorders or mental illness, but we've seen common issues for young Indians: depression, anxiety, stress. Dr. Patel spoke about, suicide and, young Indians being at risk of suicide. We've asked the team to share some suicide prevention helplines as well for anyone who might need to have those handy. But are you seeing then that there are more concerns with some of these specific issues? And I'll actually weave in that question on eating disorders, because you alluded to that as well. Someone is asking if you can talk a little bit more about eating disorders and whether the pandemic has exacerbated this.
So to take on the first part of the question, really about whether we are seeing more. The truthful answer is there's no way to tell, because the prevalence rates right now, there's no real eye on it to say, has it increased from before or not? So I can tell you from my clinical experience in terms of, I've been practicing now for the last several years, so whether there's any change during the pandemic or not. Yeah. So take it with a pinch of salt. I think Dr. Patel might be a better person to answer whether overall in terms of research, we have an eye on whether our numbers are actually increasing in terms of prevalence or not. But what I can tell you is that the trend seems to be changing. And in the first half of the pandemic, or the first year of the pandemic, we did not get as many of the anxiety and the depression spectrum as we are getting now. So there seems to be a change in the second wave and onwards in the kind of clinical presentation we are getting in young people. There also seems to be a change now, much more than earlier, in the eating disorder, at least in our clinical practice, where I would work with 2 or 3, and we have a team of about 40. So as a singular clinician, in that if I worked with 2 or 3 at a time in a point of time, I'm now working with 15 or 16 people with possible eating disorders, and many more with disordered eating, which doesn't qualify yet as a diagnosis of an eating disorder or a mental illness. So what is changing is also that possibly young people who are sitting at home, and please remember, I come from an urban Indian health setup. So what's happening in the rural part, I'm not even necessarily the best person or an expert on. We do work with some of the underprivileged communities, and so I can tell you a little bit about that, but this is really not representative of the rest of India. Yeah. So what we are seeing is that certain kinds of problems seem to be emerging more than others. And the kind of stress that happens when people live together for long periods of time, and children do not have another ecosystem, parents do not have another ecosystem to buy into. Because one of the things that's happening is everybody's at home. And while that may be beautiful in certain families, they've talked about bonding, increase in language, increase in For others, it is not a safe enough place for them to be able to express themselves. And that can lead to a whole lot of stress. So increase stress-related mental health difficulties in young people with the time to spend to introspect a lot more. Because there's nowhere else to go. So you can't go out, so you go inwards. So that we are seeing a lot more of. Young people presenting, saying something's going on with me and I'd like some help. Young people who probably wouldn't have reached that threshold and come to us prior to the pandemic and probably would have looked at it as a phase and gone off. So distress and difficulty and dysfunction seems to have increased a lot more. Specifically body image, I would say, not just eating disorders, but the amount of concentration, the amount of intentionality, the amount of attention on body image, looks, appearance, what I look like, what kind of a virtual identity I have. Again, I'm talking far more about the urban young Indian population. This has increased remarkably. And now, not in the first year as much, but now in the last 3 to 4 months, we do seem to have a lot more of young people coming in, or parents getting them in, saying that whether it is exercise, whether it is going out, whether it is eating, whether it is how I look, what I want to do with my appearance, all this is definitely on an increase. The second part of the question that you talked about, eating disorders themselves, in my clinical practice, yes, there has definitely been an increase. I'd be loath to say that I know why, but I can make certain assumptions. What I do see is that there is a lot more of preoccupation. So if we look at young people, one of the things in their developmental stage is peer relationships. It's the highest part of, and the only way of doing or engaging in peer relationships right now seem to be through the visual and the auditory, which is through technology, not really in any other modality. Presence in terms of sitting face to face or having nonverbal cues or the entire sense of demeanor, presence of a person is not as well, it's not accessed. And some of that is translating into how do I present myself on screen has become a very big part of a teenager's identity. And I do think that that is also, and one very small thing in things like Zoom and in any of these sort of online portals, a very unnatural thing is that while you're conversing, even as now we converse, you can look at yourself. In human conversation, you do not get that feedback. You do not get feedback of your own face. And that's a very strange and unnatural thing, that the only social interaction that we are having with people, or the majority of it, is that you can see yourself. So part of your attention is going to go on yourself. And at the age that they're at, where self-consciousness is and self-awareness is one of the things that they're concentrating on, I think this is sometimes also one of the reasons that they're, but this is an assumption on my part, so I'm going to stop here. And,
it's I was just going to say, it's hard enough as an adult, now that you mentioned absolutely. What we're looking at on a Zoom screen, I'm like, you look at the camera to talk to people, I'm looking at you while they're talking.
Absolutely. So I'm speaking from what some of the young people tell me and why they don't want to put on their cameras even during online classes.
Sure.
Yeah. So
no, that's a huge factor. Dr. Patel, you've also spoken about, and I think at some level, everyone's being really careful because we can't generalize, right? There are so many different experiences. There's socioeconomic disparity. You've talked about the disproportionate impact when it comes to, different populations. What are some of the factors that you can speak to that have made things worse or better for young people during this time?
So, I just want to continue off from where, Kavita rightly pointed out, the developmental stage of youth is one that we have not really recognized and acknowledged as a very unique stage in our life course. For very long, we thought the brain largely developed only in the first few years of life, and that is actually true. But we also therefore thought that, after you hit puberty, it's really pretty much only brain loss. That is to say, you just gradually lose, the density and the number of neurons in your brain all the way into old age. We now know that actually that is not the truth. In fact, during the years between puberty up into the mid-20s, that there are some amazing changes happening in our brain in terms of how different parts of our brain mature. And it is because of that understanding that we can now explain why this phase of life is associated with impulsive behavior, with thrill seeking, with risk taking more generally. If you think about it, it's quite amazing. We make the most dramatic transitions of our life in just 8 or 9 years of that life. Before the age of 13 or 14, we are in our prepubertal years, we are almost completely dependent on adults like our parents for everything, all our needs. We leap from that complete dependent status to being completely independent and in fact caring for others in the short space of 7 to 10 years. And if you imagine what COVID-19 has done to all the necessary processes that we need to engage with in order to make that leap, it's been devastating for very many young people. Let me just give you 3 examples of those transitions. The first is the transition that we make in our education. Within our earlier years in primary school in particular, it's a very cosseted, a very safe, a very secure environment. As you make your way into high school and into college, you are now facing a lot of very important life decisions that you have to make that will determine, in fact, what will happen beyond. That is not the case when you're in primary school. Everyone goes through exactly the same primary school. That's one important transition, which is education. And we know how dramatic a disruption there's been to particularly higher education during these last 18 months. The second is in employment. My own son, for example, graduated from college in the midst of the pandemic, when in effect, the employment job market had evaporated. And so that is a second important transition towards economic independence, which again has been completely disrupted. And I fear that unless we take very urgent steps towards thinking about young people's employment, that in fact the situation will only get worse in the months and years ahead. And the third important transition is in forming relationships. Not the relationships that you're forced to have because you're all stuck in the same class, but the relationships you choose to have. For example, intimate relationships. And again, of course, this very fundamental need of adolescents and youth, which is peer relationships, has again been completely disrupted. And I think all of us will know that you cannot replace in-person engagement with others on Zoom. It's just not possible. There are certain things you simply cannot do on Zoom, and you can, use your imagination to figure out what those are. And so I think, the denial of those kinds of opportunities for transitions, I think has been incredibly devastating. I'd like to say, though, that there's been one very good thing that has happened during COVID-19. It's not all doom and gloom. I mean, many young people have found themselves growing quite dramatically, during these last 18 months, and maybe we can talk a little bit about that. But one area where I think it's been really important, and this may speak to some of Kavita's observations as well, is the opening up of conversations around mental health. I think that, if, for example, in clinics around the country and overseas, you see more people coming for mental health problems, it's very hard to unpack how much of that is because actually the burden of mental health problems has increased, which I do think is, in fact, it has, from how much is it just more acceptable to seek help for mental health problems. That's the first important piece, which is conversations around mental health and mental health problems has become much less stigmatized. There's much less shame attached to talking about one's mental health. But the second is it's a lot easier to get mental health care because that is where Zoom has become incredibly powerful. I mean, Zoom, I only use as as an example of the many different platforms that can be used to seek telehealth services. Now, imagine in the past, you had to call an office, make an appointment. Then there was a kind of discomfort of going to a clinic that said mental health clinic, then waiting in a waiting room with a lot of other people. Now you can do this in the privacy of your own home without any disclosure attached to it. So I think in these ways, the access to mental health care has improved tremendously. And that is at least one positive thing which I hope we can build on in the post-COVID world.
Thank you so much for that. Dr. Chhabria, can we ask you a little bit about grief and bereavement? There are so many young people who've lost one or both parents. They've lost relatives. They may have lost friends. We know that people have really not had the time to, the opportunity to mourn together. Some of these, customary practices that, bring us together. You were talking to us a little bit earlier about, 400 kids in Maharashtra. Can you share a little bit on what are some things that families can keep in mind?
Sure. So I think this entire process of grief, and even before the grief occurs, what happens is that we have seen in certain cases that people have lost their loved ones just because they could not give them the help that they needed. And that has also led to a lot of anger and frustration. We've been working we started grief and bereavement groups early in the pandemic because we thought that this was the need of the hour. So we've been working with groups of people, helping them to go through their emotions. And what I would like to share here is that it's important to grieve. It's important to go through the process of bereavement, because if in any of these stages, if our emotions, it's not that if you don't think about it, it's going to go away. In fact, it may lead to serious mental health issues. So what I would advise people who have, please do not make certain statements to young ones who have lost either a parent or a relative. Please do not tell them, no, everybody goes through it. Everybody does not go through it. It's difficult to lose a parent at any age. I understand what you're saying. One cannot understand. It's very, very tough to lose a parent at a formative stage. So it's very important just to listen around them, to be around them, and to watch for the red flags of mental health issues. So if kids or youngsters make statements like that, I don't see the point of living. Okay, please do not jump at them and say, no, you can't be like this. Another statement that one should not make is, okay, now grow up, you're the father of the house, or you have to look after your siblings. These are statements that really create a lot of anger and resentment in a person. So I think what we need to do is we need to be listeners around them. We need to watch for red flags and any mental health concerns. So if we see behavior issues, like if you see that the person has either withdrawn or is getting extremely angry, or is, of course, one can cry together. We're telling families that if you've lost somebody, it's all right to talk about the person and to cry together. Okay, but if we feel that, recently I met someone who has been crying for a year every day, so obviously this is a person who needs help. She needs to now, and she also understands that. And she says, I don't know, but I just can't do anything. So this is a girl who has from bereavement, has gone into depression. So we need to watch for signs like this. Anxiety, depression, panic attacks. This is something that we are seeing every day. So this is the time that we need to be around them, and we need to help them to come out of their state by being good listeners, by providing them the help to take mental health counseling where it is required. Sometimes teachers can help, sometimes parents, friends can help, sometimes the family doctor can help. But at the same time, it's important to take them to a psychologist or a psychiatrist and to see how damaged have they been in the process, and how much are they able to pick up their pieces of life and move ahead, and to help them provide the resources. I was talking to you about, in Maharashtra itself, we realized that there are 400 kids who've lost both parents. There are more than 18,000 kids who've lost one parent. And while people were looking after their financial needs and their scholastic needs, what the child welfare department realized was that it's also very important to help them with their emotional needs. Because yes, someone can give you food and someone can help to pay your school fees, but you need someone to hold your hand and get you out of, just being sad and feeling lonely and just, saying, how do I get up? What do I do? I had these parents who've just gone away. Now, how do I even pick up the pieces of my life and move ahead? So we have groups for them, we have counselors, and we're trying to help them get back.
Thank you so much for that. I mean, it'd be great if we can share some resources as we go or after the chat, with anyone who's listening who might benefit from that. Let me start taking some of the questions and putting them to our panelists. Dr. Patel, Ashish Thakur has asked this question to you in reference to your, the comments that you made. He's asking, would you say the young have lower levels of tolerance of uncertainty and lower resilience levels versus the older or senior population? We find seniors saying that events like the partition helped us develop resilience and tolerate uncertainty, and the current millennials or Gen X have not had experiences to build the same. Could you be so kind as to comment on this?
Yeah, well, I think there's no doubt that wisdom, comes from experience. You learn as you engage with the world, as you encounter experiences in the world. You take risks. And you learn about, what are the kinds of decisions you make and what consequences they will have. And that obviously, the longer you live, the more likely you are to have actually had such experiences that can build your capabilities to deal with unexpected and extraordinary events like the pandemic. So in as much that older people have the advantage of years, yes, I do think older people, and that probably is one reason why older people have actually done much better than we had feared, and younger people have done much worse. That said, I think it's also important to remember the point I made earlier, that there is a developmental phase when you are in this particular age group, which actually also makes you highly vulnerable to develop mental health problems. So it's that, plus of course the dramatic social transitions I referred to, which don't actually happen. In older age, the most important social transition is retirement, but of course you have other transitions as well. For example, losing a spouse, and also developing other kinds of health problems. But the kinds of dramatic transitions you see in these 10 years that I described earlier, along with the developmental issues, I think means that young people are also almost biologically more vulnerable to develop these problems. So I think it's a bit of both.
Okay, thank you for that. And Ashish, for your question. Anandita Lidhu has a question. Dr. Arora, for you. Thank you for sharing your insights. She writes, just a follow-up, with a shift in developmental needs and increased stranger anxiety, which you spoke about, do you see a more introverted shift in the coming generation?
So I think, frankly, what I would say, I think it's an excellent question. It's a question I ask of myself and the team repeatedly. I don't think that we can predict the long-term consequences of what's going on right now. I think time will tell what, at this stage of development, when a child is exposed to these kind of circumstances, what would be the long-term impact. What we are seeing, however, is that as things are starting to open up in various parts of the country and children are being taken out a little bit more than earlier, we are seeing that there is a subset of children who have an immense amount of stranger anxiety and would prefer the indoors. There is another subset that would love to go out. They are dying to be outside and take in, even at the risk of sometimes, not being careful. They'd like to run out and around. I mean, in my neighborhood one day, I was walking and there was a 2-year-old who was just rolling on the garden, and the mom standing by with the pram and looks at me and says, he just refuses to go in. I don't know what to do. And he just didn't want to go in. And he's 2 to 2.5, and you've let him out onto the grass after a long time. So there is going to be different needs. There is another subset that is happy to go out, but doesn't know what to do when they go out, because the time required to develop that skill over a period of time and in a nuanced way has not been, so the opportunities have not been there. So I think we will see, and again, this is speculation, I think we will see a variety of responses in children, but that variety would look very different from a 3-year-old who was pre-pandemic. And social nuances and social skills will be a place to watch. So the socio-emotional development of these children would be a place to watch.
Got it. Thank you so much. And Nandita for that question as well. Mindful of time here, we have about 15 minutes of Dr. Patel's time. So those of you who want to put your questions to him, please pop them into the chat or on the Facebook comment box. And we have our other panelists for at least 10 more minutes beyond that. So we're going to impose on their time a little bit longer. Let me ask this question to you, Dr. Patel, before taking one to Dr. Chhabria. It speaks to a little bit of what you were talking about earlier. This is from an anonymous attendee. India's unique demographics, larger, younger population, significant rural spread, nuclear families, is going to make this challenge larger. That seems like a statement or a question. Any ability to model the impact on the workforce a few years from now as these children and young adults grow? What would your thoughts be? Dr. Patel first, maybe.
Yeah, I think this is this is really an important point that's often raised in India about the demographic dividend, the fact that India is home to the largest cohort of young people in the world. And of course, the word dividend implies that this is a potential investment for the country in terms of the social and economic future of the country. I have no doubt that that is correct. Let's be quite honest, it's young people who are not just the economic engine of the country, but also the demographic that is likely to shape the world in a better way. Let's consider, for example, the leadership of the climate change movement more globally, but also in India, has often been in the hands of young people. So I think everyone, it is in the interest of everyone in our country to make sure that the circumstances, the environments for young people to thrive are strengthened. That said, I must say that I worry a little bit because I don't think we even recognize that young people are actually a very unique demographic. To a large extent, we treat them as old children. And of course, I do draw a distinction here between children who are prepubertal and those who are postpubertal. I mean, consider the fact that in 2021 in India today, we still see situations where 19-year-olds are hauled to court by their parents because they've chosen to fall in love and live with someone that their parents don't like. It's incredible. It's actually, to me, unbelievable that we can actually, even in the same breath, talk about the demographic dividend, which implies the opportunities that we need to give to young people to become the people they want to be, that we can coexist with an environment that in certain families in certain parts of the country, young people can't even have the freedom to live the life they choose in terms of the partnerships they make. So I do think we need to take a long and hard look at where the societal and structural determinants of the well-being of young people is headed, and where we as a country would like to see our young people, what kind of society we want our young people to grow up in. It's all very good for us to give platitudes about demographic dividend. If we don't actually deliver the environments for young people to make the most of their lives, then unfortunately it only remain a platitude. And I do think that this requires a long and hard look. The other example I would say is that we hear a lot about counseling and the importance of educational institutions in particular. But look at the way we have dealt with the issue of educational institutions in the last 18 months. In Goa, which is the home state that I live in, casinos have opened, but not colleges. And what kind of hotels and bars and restaurants are functioning, but not schools and colleges. And it really begs the imagination, to try and figure out what are we thinking, that we think a casino is a safer place than a school is. So these are the kinds of paradoxes in India right now that we have to deal with. And by the way, this is not about individual practitioners delivering care. It's about the kind of societal decisions we make and whether we really are prioritizing children and young people. And I actually think, actually we're not. We love to speak about children and young people, but actually they themselves don't have their voices heard.
We have to speak about and speak at children and young people. That is really well said. I think this question from Saloni, Dr. Chhabria, I'm going to put to you just in the interest of time. Saloni, thank you for addressing it to the whole panel, though. She's thanking everyone for this important discussion. Her question is, are you seeing any gender differences in the mental health issues young people are presenting?
So I think the line between gender, I see it blurring where you're talking about the urban kids. But of course, in the rural household, we see a lot of difference in the gender, because what we see is addictions are more common in the male gender. And in terms of the burden of the household comes on to the girl, even today. Or even today, as Vikram was pointing out, she may be forced to get married to someone of her parents' choice, whereas the burden of being the breadwinner comes on to the boy, and all this, the reason I'm calling it a burden, because from stress, it becomes distress, and then it becomes depression. If you're looking at the urban, I do not think there's too much of a difference, because we see both girls and boys suffering. Yes, sometimes we see anxiety disorders more common in girls, eating disorders and body image issues more common in girls. But actually, you scratch the surface of the boy, and you will see that he also is worried about gaining weight, or is also going through some kind of eating disorder. So I think the line between the genders is definitely blurring.
Okay. I'm going to put one question to both Dr. Arora and Dr. Patel. How can schools, no pressure, how can schools and online pedagogical frameworks prepare for the third wave, which is likely to affect children?
Vikram, would you like to go first, or should I try? It's a very, very broad question. So I think instead of saying how should schools do it, I think the important part is what Vikram started off saying, what is the need of children right now? Because from there will emerge the solution of what can we do as an educational institution, as a mental health practice, as a community. Because we're really not understanding what the need is. We are saying school is equal to curriculum, is equal to education. We are not looking at learning. We are not looking at what is it that children have needed, or even the young adult population has needed the most in the last 18 months. What ought to be our priority? So the question really is, what would a framework be based on? So much like we are saying, just that because we closed down, curriculum has to go on. So children have to sit for 5 hours and do the same subjects. That's not a framework for the pandemic time at all. We have told children time and time again, you cannot have screen time more than an hour or 2 hours a day. And suddenly from April 2020, we are telling them 5 hours of screen time and everything else is going on. So I think the question really is not what should schools do. I think the question really is, how do we build a community that thinks through this? Because there is no one, I believe, who's an expert on what is to be done right now. All predictions have time and again been proven wrong. There is no certainty. So the only way forward is to form a community, I believe. And that community has to essentially have children in it and their voices in it. The 14-year-old, the 16-year-old, the 18-year-old knows what their needs are. So I think what schools need to do is not to send out letters, which is what's happening in the NCR, letters to parents saying, are you going to allow your child to come or not? And based on that survey, we are going to decide whether there's going to be a hybrid model or it's going to be an online model or not. No one's asking the kids. We shut schools down without asking them. We told them to stay online for 5 hours without asking them. Now we are telling them, we are going to decide whether you're going to start school or not. You don't have a vaccine. We do. We're going to send you out again into schools based on, we don't know what the decision is. We don't know what parameters we are using. So much like what Vikram is saying, are we really thinking about the needs when we are providing solutions? So I do think that making communities, and here I'm going to talk a little bit about one of the pilot projects that we've recently done with the Delhi government schools, approximately 200 teachers. And the Delhi government said, these are teachers who have had to think differently during the pandemic. They are going through grief and loss. And this was right smack in the middle of the second wave. So this was May and June that I'm talking about this year. They're trying to teach children who may not have access to the online mode. The children are themselves going through probably a lot of economic losses, because remember, these are government schools we're talking about, and grief and bereavement. Teachers have no way of knowing what the context of this child is. Is he standing in the line to get grain from the shop while he's attending class, which is what one of the teachers explained one of the 8-year-olds was doing while class was ongoing. But he's so keen on his education that he's actually carrying his phone with him while standing to buy grain. Now, the question they were asking was, we cannot be teachers in the way that we used to be, because the curriculum is meaningless right now when this child is actually struggling with a father who has to go out to work and expose himself to COVID, a mother who probably is sick, and all those various factors. So what we arrived at collaboratively with the teachers was how they have to step out of their comfort zone and ensure a connect, first of all, with these children to make anything meaningful. A connect, then a sense of continuity, and then a sense of community. And once we are able to learn life skills of how I'm going to manage this, where do I belong, how do I learn what I wish to learn, what I can teach each other, that seemed to be something that was very powerful that came out of that series of workshops. So I don't think curriculum or frameworks are necessarily going to work unless they are context specific. Something very different may work for an urban upper middle class school versus a government school versus a rural school. So I'm sorry, I'm turning the question around, but I do feel that we're probably not asking the right questions in this particular.
And I think your point on the emphasis of the community building, making sure that we're addressing the context there. Dr. Patel, actually, can I club this with a final question for you before you have to go, which has come in, and this is sort of what we were discussing earlier. Have there been any notable efforts? This is a question that came in from an anonymous attendee. Have there been any notable efforts in any countries to proactively handle potential mental health issues of children due to unforeseen catastrophes like COVID-19? Do you have any strong case studies or references you want to share?
So maybe I'll just wrap in my response, by also addressing the role of schools in that context. So first of all, just to build on what Kavita said, I think the most important point is that the most important mistake I think we made at the outset of this pandemic is to think that schools are places where kids go to learn geography and science. Or rather think that's the only function of a school. If anyone had spent a moment talking to an educationist, they would have known that schools are much more than that. It's a place where young people actually go to play. They actually go to make friends, and this is what is a fundamental life learning experience that cannot be transferred onto Zoom. The other thing people would have learned, it's just talking to anyone who works in primary schools, particularly in low-income areas, is that also schools are the only place where you get the main meal of your day. So I think the whole idea that schools could be converted into Zoom mediums is a total function of the class structure of our country. And I'll say one thing: this is not true only of India. This is true actually of almost every country in the world, including the US, where I spend half my time. The complete blindness of policymakers to the facts of the class structures of both these countries was made very evident in how quickly and swiftly schools were shut before any other section in society. Leave aside any conversations about what young people want. This is just simply about recognizing the inequities that exist in both countries. That said, now the question in my mind shouldn't be whether schools open or close. The question has to be how can they open in a safe and managed way. The question of black and white, closure or open, is a ridiculous binary. It has to be a question of safely reopening schools. And here I'll turn to the second question that was asked, which is case study, what are the kinds of examples that this could be done? And there are actually many examples, both in India as well as in the US, that I can draw upon. For example, in India, we have the amazing good fortune of having a good climate, so that schools don't need to be run inside closed rooms. We now know that ventilation is one of the most important ways of preventing or reducing the transmission of the virus. In India, we could have actually from day one in fact, run our schools outdoors or in outdoor spaces in vast sections of the country, or run classes in a staggered way. These are just two examples of how one could reduce the risk of transmission. The second, in many parts of the world, there's a recognition now that teachers and parents of children in school should be considered frontline workers, so that they should have been prioritized for vaccination right at the outset, so that this existential fear that the kid, of course, kids themselves are almost completely unharmed by COVID-19. The real fear is that they'll bring the infection back home and either infect the teachers or older people in their own families. Well, that could have been planned for and preempted by treating teachers and parents as high risk groups, and in fact that's happened in many countries as well. And finally, I think there are many NGOs, many examples that we've heard already today, but I want to just also mention the work that Sangat, an NGO that I'm associated with, has been doing in developing interventions that can be delivered in schools, either in person or remotely, to promote problem-solving skills. This is actually very much more preventative intervention. And what this is seeking to do is to actually provide young people with the skills in order to deal with unforeseen difficulties that they will inevitably encounter in their daily lives. It's a well-established psychological technique, problem solving. And what we've tried to do, or what my colleagues have tried to do, is to use peer counselors or digital game-based delivery to teach young people those skills. And we're rolling this. We've been working in schools both in Delhi and in Goa, testing these, and hope to actually do a much more formal evaluation in the coming year. So I think there's a number of different case studies, both in terms of how you organize schools and what you do within that actually can help reduce, mitigate, and hopefully also prevent mental health problems in this vulnerable age group. But with that, I want to thank you, Amrita, and my fellow panelists, and just apologize that I have to actually leave now for a class.
Thank you so much. And also congratulate your son for graduating from all of us, and good luck to him going forward. Thank you again. Bye.
Bye-bye.
Dr. Chhabria, can I come to you with this question? There's a couple of questions I have for both of you. We still have about 10 more minutes, so we'll try. There are a lot of questions that have come in, but we'll try and get to as many as we can. Somebody who's written in anonymously has said they agree with you in regards of the kind of statements one should not make. Being someone who has been living with depression for years, I do understand how hurtful statements can be, even though that may not be someone's intention. However, as you mentioned, everyone's circumstances are different. With the pandemic, I've often found myself and others as well not knowing what to say to those who have lost someone. Could you highlight the things one can plausibly say, or how can we be around those who have faced loss?
Just put yourself in the shoes of the person who has lost somebody. Is it important to say anything at all? Sometimes just being there and allowing the person to express what they are feeling is enough. You know, a hand on the shoulder, okay, to just be around and even just see whether they're just being able to function, you know, whether they're sleeping enough, whether they're eating. So I think just asking them the basic questions about how are you doing, you know, I think that's enough. And once you see that they're able to cope, and of course, if two of you have lost a family member, you know, and one is suffering openly more than the other, you know, sometimes also what people do is they feel that, oh, let's not talk about the person who has gone away. You know, let's just pretend that everything else is fine. Let's just try and accelerate. You know, I met someone who says, how can I forget about my husband? I said, you can't forget about him, you know, and don't even try to forget about him, you know. So let's just go with the flow and let's get all of us back together, you know. So maybe if the family just starts eating together, you know, and is around each other. And what has happened with the COVID is, you know, earlier you had the extended family being around, there were rituals, all that is missing now, you know, and it's almost become normalized that if there is a death today, even if it is non-COVID, you know, I think the norm has become that everybody is not gathering there, you know, and families are grieving alone, you know. So just reaching out to people over a message or a phone call, you know, and asking them how they are doing. And I think the most important question that one can ask is, you know, I'm really concerned about you. I want to be there for you. How can I be there for you? whether you do it verbally or non-verbally. These are some of the statements that you can perhaps start with. And as the conversation goes, allow them to talk, allow them to show their anger and resentment. Someone is allowed to be very angry with his father for going away at a time when he needed his college fees to be paid. It's all right. And then once people go through, in fact, this is what we do as a part of our groups. We've shared the link in the chat if anyone is interested, is that we allow them to process their emotions, and come to a point where they want to pick up the threads of their life and move again.
Okay. Thank you. Thank you so much for that. And thank you for the question. That was a very thoughtful question as well. Dr. Arora, Sangeeta has a question. How do we deal with academically gifted children who have scored less marks than they expected to due to cancelled exams by all boards?
I'd say ask them, invite them to think about what's going on, invite them to talk about their feelings about what's going on. See, what's happened really is standards have changed. The ecosystem around children, in terms of whether it is the educational institution or it is the parameters that they are, used to working towards, all of it has changed. So to expect similar outcomes as they were getting pre-pandemic in anything is also going to be something that you have to do expectation management for. So how important is it to get the marks is the question. And how are they feeling about it? So if you already know that you are gifted, so the question would be, in my mind, it would be, if I know I'm gifted and my performance in this year is not showing it, how is it impacting me? And what do I want to do about that? So I don't think it's about managing the marks necessarily. Most of the time, it is the impact on the child or their understanding of the meaning of this to them. And I think sort of deconstructing that with the young person, I'm not sure what age they're talking about. So if they are, at an age where they can converse with you, that would be, I would say that right now, the most emphatic message that I'd like to give to all parents is please attune and then invite your children to express. Children have been often a passive recipients of the pandemic in the way that we have dealt with them. However, they are not, they are very active. I believe this is the generation, this is the age group that's going to carry the pandemic within them the longest and the effects of it. I think inviting them to take part, not just in the problems, but also in how they can contribute, is a very powerful thing. I think young people that I talk to every day have absolutely brilliant ideas about what can be done. Many of them were as frontline during the second wave and helping because they're great with tech. They're the ones who know the virtual medium the most. But we are underutilizing them. We are saying you just study. However, they can actively participate in so many aspects of the pandemic and feel good about it.
And so many, I think the young adults, so many of them have been galvanizing support, right?
Yes, absolutely.
Actually making such a difference.
Yes.
That makes sense. Go on, sorry. You were...
No, I was just saying that I think there is a huge amount of resilience that's also something that we are seeing. So while there are a lot of problems and there's been a lot of increase in mental health issues, so to speak, what I've also observed is people, especially young people, are doing a lot more and are concerned a lot more about social justice and how our social constructs, which are actually getting exposed, how the fault lines have become greater during the pandemic. What we talk about often in adult conversations, I think children are far more aware today from the 14 to 20 age group than they ever were. And I think they're dying to participate and we should invite them to participate.
Amrita, if I can add one thing there is, see, actually, this is the point, if a child is feeling bad about the fact that he or she has not received marks, I think this is the beginning of a conversation, which the parent should encourage, I had a kid like this who actually came to me, and today, and so when we discussed this, and I asked her, what more would you like to do? Okay, come on, if you had the best marks, what would you like to do? And she, on her own, ended it by saying, I would like to do something for the society. I said, who's stopping you now? She actually started a small NGO which her parents supported her in. She used to cook food for people and go and distribute it. So this is where the transition from your IQ goes into EQ. And today what we are talking is about resilience. This is what resilience is. The kids have got a chance to experience something, and how we as parents experience it. Children are looking at us. There's a question there about resilience. Children look at you all the time, and what you say does not matter. How you cope with the situation. And if there was one advice that I would like to give all the parents here is, take care of your own mental health. Understand your own anxieties. If something is making you anxious, go down to the bottom of it and see if you can do something about it, or you need to accept it. And once you do that, you're actually teaching your kids lessons that no book or no school is going to be able to teach.
And I have a feeling people are just going to, assessments are just changing as we go, right? I mean, we're not going to be using the old methods to assess our kids and as we go. We're going to try and squeeze in a few more questions. You all have been sending in fabulous questions, and hopefully our panelists can answer some of them now and some of them later on. This is a long question, but sounds like a really important one. It speaks to what you were talking about earlier, Dr. Arora. I'll put it to you and Dr. Chhabria both. How do we ensure young children learn to balance every aspect? Learning, studying, play, hygiene routine. As I've noticed, most children are less bound to a routine. They're more inclined to play or watch YouTube endlessly rather than learn, even if it is through play. And sometimes even the basic brushing and bathing routine seems to be too much to follow during the lockdown. How do we deal with this?
Sorry. So first of all, I'd like to say that, when I read this question, I realize it applies to me as well. So maybe I'll like to take the privilege of being called a child as well. I think this is across the age span. I think what's happened in the pandemic in terms of what we are prioritizing and what we used to do in terms of getting up every morning, even, doing your routine work. There have been times in the last 18 months for long periods of time that many adults have also said, we don't feel like doing it. Yeah. Now, what does that speak to? And then we'll come to how to balance it. Yeah. That speaks to a need within us. And it also speaks to the kind of ecosystem or structures we used to have that made us have the need to do certain things. If I have to get to school, I have to be a certain way. My social image, my clothes, my X, my Y, my Z has to be like this. Now I don't have to go to school. I can keep my camera off. What's the meaning of getting up in the morning and doing this by this time? Those questions, why is routine important for the sake of routine? Is it important for the sake of routine? Because I get a lot of questions about right now, even during the holidays, during the summer holidays, a lot of parents were saying our children do not keep a sleep-wake cycle. We don't know what to do with them. They're awake all night and asleep all day. Well, what's the meaning of this? What's the need of it? Because then the body and the brain and the mind will adapt to what is needed. So these are all things that have come up in the pandemic and will continue to happen. I think the meaningfulness of some of these routine chores in terms of, is it necessary? Is it needed? Is it my responsibility? If we answer these questions for children, then the likelihood of forming a different rhythm and routine for themselves is much more. Yeah. I think sometimes what I find is that we are still living in pre-pandemic times. Many parents would like their children to have a routine that used to be, but it is no longer contextual. It's no longer what is relevant right now. So because we used to get up at 6:30, you need to get up at 6:30, but that was because I needed to take a bus to get to school and it used to take me an hour. Right now I am 8:30, I can be up at 8:20 and get ready and start school at 8:30. So I think we are approaching children sometimes with our own rigidities as adults. And I would say making things context relevant and meaningful for children is probably the most important thing on my mind. And I've now forgotten the second part of the question, so I'm going to.
That's. I want to anyway club this with me. Just we're
Sure.
on the clock. Dr. Chhabria, can I ask you to follow on from what Dr. Arora said, and we can maybe club this with Sarla's question, which is to you: how could we focus on the holistic health of children, not just focusing on providing basic care?
So I think, I also see a lot of children actually getting into gaming addictions, or being online all the time. So while we give them a little flexibility of having their own routine, or of just putting the uniform shirt on and sitting in their pajamas, which most of us also do. But at the same time, I think it's important to keep a watch on what is happening to them, to what they are saying and what they are not saying.
Fine, but I'm going to paraphrase what Dr. Chhabria was saying, and she was saying that it is important to include the children in certain ways, and while flexibility is important and understanding is important, the need for structure is also important. But to include and invite the children to actually make it with the, and I think we are talking about the older children right now. We're talking far more about the 12 and above, where there is a sense of autonomy. For the younger ones, it may still need to be the parents that actually create a structure which is more meaningful. I hope I've paraphrased that correctly.
Yeah. I think, well, Dr. Chhabria, are you back? Is that what you were sharing? Oh dear, I do believe.
Yeah, I think that this is some, yeah.
I actually wanted to anyway, perhaps we conclude, and wait for Dr. Chhabria to come back. Dr. Arora, this is again no pressure kind of question, but if you had to leave, folks who are listening in today, there's so many things we covered. There are so many issues that are both general but so specific, because you can't take advice that's very macro level and try to apply all of it. If there was one or two takeaways you'd like for especially parents or teachers listening in, what would those be?
So I'd say one of the biggest things that I'd like to say is, don't look at the pandemic as just something which is a disaster. It may also be an opportunity. So it is providing certain things, including bonding at home, including making us think about what our ecosystem needs to look like, what is priority. So if we are able to look at it also as, how can I contribute? How can I be useful at this point in time? And how can I take this as an opportunity for learning more about myself, more about my family, more about what I want? I think that's something that I would really want people to start thinking about in terms of questions. The other key takeaway that I think I've said during my, whatever chance I got was, please invite the children to co-create solutions. You'd be really surprised at what they have picked up during these last 18 months and the kind of wisdom that they have, which we sometimes haven't tapped very well.
That's really, really well said. Dr. Chhabria, you're back. Can you hear us?
Yes, I can.
So we were going to conclude. If you want to just paraphrase a little bit of what you were saying, and also I was asking for one or two, key takeaways for anyone listening, because we've covered so much. But any parents or teachers listening, what are the takeaways you want to share?
I think the first thing is take care of your own emotional health. Be ready to give them partners in whatever solutions that you want to take, and you'll be surprised at what you get to see. And be ready for bad connections.
I was going to say, I thought your connection doesn't like my question. Yes, be ready for pretty much anything, right?
Yeah.
That's lovely. And someone did ask, what was the NGO that Dr. Patel named? It's Sangath, SANGATH. We'll ask our panelists if they want to share any resources through the Asia Society India Center. But I think we will wind down there by thanking you so much, Dr. Arora. Thank you, Dr. Chhabria. We thank Dr. Patel. Thank you to Dr. Firoza Godrej, Inakshi, Karishma, and most of all, thanks to all of you who took the time out today to join in, to send your questions. And hopefully you've learned as much as I have. Thank you all very much.